So our person of interest today is someone whose work is hugely inspiring. It's a slightly complicated technical topic. His advancements we're going to break down for you in just a second. We're going to be focusing on something called PAM. This is the primary amoebic meningoencephalitis. We'll break down what it is for you in just a second, but don't let the complex name throw you off at all. We'll tell you a little bit more about it. It's a rare but very deadly brain infection. It's caused by a microscopic organism, and it's often referred to as the brain-eating amoeba. While it sounds like something out of a science fiction movie, it is very real, it's very serious.
Now, this thing called the Naegleria forrida, I hope we've got that right, is found in warm, freshwater environments like hot springs, lakes, poorly maintained swimming pools. The amoeba thrives in these environments, and when water containing this particular organism enters the nose, it can travel to the brain, leading to rapid and severe infection. Meaning, firstly, stay out of swimming pools this monsoon.
Its very complicated name is why we refer to it as PAM. You'll see it called PAM, PAM, everywhere in reports. And the key is that it's not actually contacted by drinking any kind of contaminated water. It's about the amoeba actually entering your body through your nose. Once it's inside, it can cause inflammation, destruction of brain tissue. It can lead to symptoms like severe headaches, fever, nausea, vomiting. In the advanced stages, you can even have altered mental state, seizures, and even coma.
And the infection also progresses quickly, often within a week, and can be fatal. However, it's worth noting that PAM is extremely rare. There have been 5 cases, including 3 deaths of the infection in Kerala in the recent months, however.
Now, the particular case we're taking a look at today is a 14-year-old teen, Afnan, and it's important to tell you that till now the mortality rate was about 100% in Kerala. This case obviously reverses those fortunes. He survived PAM, and we wanted to speak to the doctor who was behind it, because now he is one of 11 people across the world that has successfully combated this entire disease. So as we speak, the actual mortality rate is about 97%. If you take these cases, we have a very special guest, as we told you already. We have the doctor who pioneered the effort to steer him to safety. This is Dr. Abdul Rauf. He's a consultant pediatric intensivist at the Baby Memorial Hospital in Kerala. Doctor, thank you for joining us this morning. Dr. Afnan is, it's fair to say, the boy who survived. Tell us, what differed in the treatment that you gave Afnan from the kind of treatment others who were trying to fight this case, they received?
Yeah, that's a very relevant question. So here the diagnosis was very early, and the treatment diagnosis was established within 24 hours of the onset of symptoms, and treatment was also initiated. That was the major difference. Second thing is, in the previous cases, a drug called miltefosine was not available. That was also that was ordered by the government during the last case itself. But in last patient, we could give it only for 2 days. For this patient, from day 3 to all other treatment regimen, miltefosine was also available. So if you see, the symptoms in primary amoebic meningitis are very similar to any other meningitis. So most often what happens is, when the cases come in random, we start treatment for a bacterial meningitis. Later, when the patient is not responding, then only we think of amoebic meningitis. By that time, bus would have been gone, because this disease progress so rapidly that once you get a patient after day 3 or day 4, then it's very difficult to save them, or they don't respond to medications. So the most important was here the early diagnosis and early initiation of treatment.
Doctor, well done, and congratulations on finding a way to actually cure this and get people to survive despite this sort of brain bug, as it is now called. So tell us, how does one identify or do a quicker diagnosis of this disease, since you're saying that's the key to saving lives?
Exactly. So as we discussed earlier, so as soon as, if anybody develops any symptoms like headache, vomiting, fever, etc., within 14 days after a swimming in a pond or a contaminated pool, etc., there have to be a suspicion of primary amoebic meningitis. And the important thing is that in the routine test, what we do for meningitis, primary amoebic cannot be picked up. So unless we suspect it, unless we specifically ask for the history of swimming, it is likely to get missed. So we have to have a suspicion, and we have to order a CSF wet mount examination along with the routine CSF test in when you have a strong suspicion of primary amoebic meningitis.
Doctor, tell us, in Afnan's case, we know that he was having seizures before he came to you. That's actually what triggered his dad to actually come to you. How is he now? When we're saying he's cured, is he perfectly all right? Is he healthy now?
So because his diagnosis was very earlier, and he completely started recovering within 1 week of treatment, and he was discharged after 3 weeks of in-hospital treatment, and he came for follow-up after 1 week of discharge yesterday also. He's doing absolutely well and is neurologically completely normal. So if we see the survivor data, many of the survivors have some neurological deficits initially, and that take some time to recover. But in Afnan, the recovery was complete, probably because of the early diagnosis.
You're absolutely right. Meningitis and encephalitis, stuff like that can really destroy lives even after survival. So that's, kudos to you really for figuring that out. I'm sure the family is very thrilled at this point. Has this given hope to others as well?
Yeah, they were very happy, in fact, and actually he was the only child of them. And once he came and once the diagnosis was made, same time the other amoebic deaths were reported. So they were initially very scared. Later, but we saw him serially recovering, and we ensured them, and ultimately they were very happy. And both the child and parents told that they felt it was their second life. A new beginning and second life. Yeah.
Doctor, we've been hearing Kerala, Kerala, Kerala when it comes to PAM. But what is the prevalence? Because this seemingly happened because he was swimming in contaminated water. That takes place across the country. What's the prevalence of PAM across the country? Are you hearing about other cases?
There are some data because these cases occur in random. There are case reports, and if we analyze all over the country, till date there have been around 30 cases reported, 30 cases reported, and in Kerala around 10 to 12 cases have been reported till date. So regarding Kerala, the first case was reported in 2016. Afterwards, it was like one case every year or one case every 2 years. But this time there is a clustering of cases. 7 cases have come from different localities. Now, I just inquired with my doctor colleagues all over the country, and I could find that in Kolkata also, a few days back, there was a report from Kolkata that they have diagnosed 6 to 7 cases in the last few months of primary amoebic meningitis.
All right then. So this could be not just a Kerala problem, it could be other places as well. Thank you so much, Doctor, for joining us and with all the efforts that you have put in.